Hello, my name is Georgios Tzimas and I'm a chief resident in the Department of Cardiology at the University Hospital of Lausanne. We know that endocarditis is a life-threatening condition and prompt diagnosis is essential in order to achieve optimal patient management. Although the guidelines are very clear, some aspects remain unanswered, like do we have to perform an echocardiography in low-risk patients with a suspicion of infective endocarditis. Multivariate scores have been developed in order to identify those low-risk patients for whom echocardiography appears less justified. So in our prospective observational study, we sought to evaluate the performance of these scores in clinical practice for hospitalized patients with suspicion of infective endocarditis. So let's have a closer look. The Vista score has been developed for patients having bacteremia with Staphylococcus aureus. And on the left side, we're seeing all these clinical parameters, and each of them has a score. And on the right side, we're having the ratio of infective endocarditis and a cutoff value settled at 2 with a great sensitivity and negative predictive value. But if we're going to see our ROC curve analysis, we don't have the same results. On the blue line, we're having the Vista score as a continuous variable, and on the red line, the Vista score as a binary variable with a cutoff value of 2. And we can see that the accuracy is really low, especially for the red line. As for the DeNova score has been developed for patients having bacteremia with Enterococcus faecalis. On the left side, we're seeing the clinical parameters and the score, and on the right side, we're seeing a ROC curve analysis with great results, and the cutoff value settled at 2. But again, if we're going to see a ROC curve analysis, we don't have the same results as previously seen. On the blue line, we're having the DeNova score as a continuous variable, and on the red line, the DeNova score as a binary variable with a cutoff value settled at 2. And we can see that the accuracy is really low, especially for the red line. And lastly, the Hendrickscore. The Hendrickscore has been developed for patients having bacteremia with beta-hemolytic streptococci. And on the left side, again, we're having all these clinical parameters, and on the right side, the ROC curve analysis showing excellent results with a cutoff value settled at 2. But again, if we're going to see a ROC curve analysis, we're going to see that the accuracy is not great. We don't have the same results, and especially for the red line. The red line is the Hendrickscore as a binary variable with a cutoff value settled at 2. So these studies suggest that we can skip echocardiography in those low-risk patients with a suspicion of infective endocarditis. But our data didn't confirm the hypothesis. Hence, we recommend to perform an echocardiography in those low-risk patients. Thank you very much.